World Humanitarian Day for us is important because it makes that link between the climate crisis and the human health crisis. It puts a human face on climate change. That we as scientists have been talking about climate change for a long time as an environmental issue, as a developmental issue. But climate change is something which is unfortunately already killing people and will only get worse out into the future if we don't make our societies and our health systems more resilient, and if we don't start to drive down carbon emissions. So World Humanitarian Day should really be the human face of that, the code red that the UN Secretary General has just called in relation to the recent report of the Intergovernmental Panel on Climate Change.
And how shocking for you, I guess your ear is close to the ground, but in terms of what's happening to the planet and the acceleration and the speed of change at the moment, and the fact we seem to be fighting a losing battle to hit the short-term goals, how much of a concern is that for you?
Well, this is an absolutely massive concern. It's a fundamental concern that should be a concern for everybody on the planet. And it's not the case that the science of climate change has changed very much. The recent IPCC report has more or less, in terms of the global climate system, has just reinforced what scientists have been saying for well over 30 years now. The real shock, I would say, is that even with this relatively small amount of warming that has already occurred and is in line with the predictions that have been made for decades, we're already seeing these rather severe impacts. And we've talked about heat waves, we've talked about temperature records being broken, we've talked about floods and droughts and wildfires. And unfortunately, the impacts that we're seeing at the moment are the consequences of the poor decision-making that's been happening over the last 30 years or so, the failure to come to grips with the climate crisis. And so that should be the wake-up call that we need to take the steps now. We need to take them this year in the run-up to COP26 in Glasgow, so that 10, 20 or 30 years from now, we're not living on a planet which will be very much worse, very much more severely impacted than the one that we have at the moment, so that we're not looking back with even more regret at our failure to take account of this crisis and to address it. That really has become absolutely imperative now.
So we've been seeing some of the obvious visible impacts in recent months of extremes in weather, floods, drought, fires, those sorts of things, and they might present an immediate threat to health. But what are the longer-term challenges to health from climate change?
Well, you're absolutely right to put the focus first on the most direct impacts. We're seeing temperature records being broken around the world. That's not just uncomfortable for people. We know people die when we have heat waves. We've seen the wildfires, which come from the increased temperatures and the drying. We've seen the air pollution that goes with that, and the direct deaths and massive health impacts that come from those. But you're also right to point out that this is just the tip of the iceberg, as it were. All of the systems that support human health are highly dependent on weather and climate. So if you think about the availability of fresh water, as the planet heats up, as precipitation patterns are interfered with by climate change, we get less predictable rain, we get more floods and more droughts. So that affects the supply of fresh water that we need to protect health. It also affects our agriculture and food supply systems. So it's still one of the biggest burdens of disease that we have globally is undernutrition. And as the impacts of climate change hit, we're seeing those disruptions in food supplies, particularly for the poorest populations in the world. And of course, that feeds through directly into death and disease. And then you've got the really long-term risks. So you've got climate change raising sea levels. You've got it determining patterns of things like floods and droughts over long periods of time, which over time will actually force people to move from where they're living at the moment. And although it's hard to put numbers on this, we know that that is also going to be a risk factor, at least for conflict, as people are forced to move from one part of the world to another.
You talk about conflict, and we're used to seeing refugees fleeing conflict. We've got the situation, obviously, in Afghanistan at the moment. But I guess we're going to see more refugees from the impacts of climate change, climate refugees in some respects.
We're already seeing them, unfortunately. Usually climate change comes on top of other problems. It's seldom possible to say that an issue is only caused by climate change or people are forced to move only because of climate change. But in some parts of the world, we really are starting to see that. And so we see in low-lying areas, some small island developing states, particularly in the Pacific, that basically it's become pretty much impossible now to sustain life in some parts of in some of those environments, and so those people really are having to move because of the impacts of climate change, and those are only the ones we can point to directly. As I've said, in other situations, you have people living in poor and precarious circumstances, where the impacts of climate change are just the straw that breaks the camel's back and forces them to move. So whether we can formally say they're climate refugees or not, we do know that climate change is at least an exacerbating factor, forcing people to move around the world.
We've just seen the publication of the IPCC report and calls on policymakers, and particularly at COP26 coming up in November, to make ambitious and big commitments to cutting carbon emissions to minimise the impact of climate change, or at least to attempt to stop it getting worse before they can make it get better. But where should health be on that agenda at COP26?
Well, we think that health should be absolutely central to the agenda. Officially, it is. The climate change treaty that was signed, the convention that was signed in 1992, actually has health at the center of that. And that makes absolute sense. If you ask people in the street, what are their concerns about climate change, and you put on the table the evidence about what it does to their health, the health of their children, the health of people in the future, that usually is their number one priority. We've also seen with COVID that basically economies around the world have stopped because of COVID. So people do take health so seriously that it should be absolutely at the core of decision making of any big development or discussion about the future of the planet. But the real reason why health, we think, should be central is because we know now that it is in fact the sensible, the economically viable thing to do to cut carbon emissions. There are good green jobs. There's a better life for humanity if we cut carbon emissions, aside from doing what we need to do to protect the climate. And a large part of that future positive vision is, in fact, that it is a much healthier world. We know that the burning of fossil fuels is now basically burning up the future of the planet. And so we need to get off them as soon as possible. But we also know that if we get off fossil fuels, if we are able to make that transition to clean energy sources, more sustainable food systems, urban planning that allows people to walk and cycle rather than forcing them to get into their cars, that is in fact a much better future for the health of humanity, in addition to being a better future for the climate of humanity as well. And the gains are absolutely enormous. Unfortunately, we lose over 7 million people a year from air pollution. So as we clean up the energy system, we're not only fixing the climate, we're also saving almost countless lives from clean air, and there are many other benefits that go along with that. So it's not a complaint from the health side that health needs to be more central to the climate agenda. It is actually the most positive argument that we have for why we need to address climate change.
I've been talking to scientists in California, measuring the carbon dioxide in the atmosphere, but also studying the smoke that's created from the wildfires. And on the one hand, they're starting to accept we may have now an annual smoke season, as a result of this. But also the studies show that smoke itself is very toxic and very detrimental to public health.
That's absolutely the case. I think wildfires is one of the. It's not a shock. Scientists have been telling us for a while we need to be concerned about the increased risk of wildfires as the planet heats up and parts of it dry out. But to actually see it in action, to actually see those impacts happening now, the science is pretty much the same as it has been for quite a long time about knowing the impacts that we're having on the global climate. What is a shock is seeing some of the impacts that are already coming through, even at those quite low levels of warming. And so those wildfires, you're right. I mean, they're burning people out of their homes. They are killing people directly, but they're also producing large amounts of toxic smoke. That means that in some of the richest parts of the world, California and the western coast of North America, we're seeing levels of air pollution that are as high or higher than in the poorest parts of the world. Places like polluted cities in India, which have a historic problem of air pollution. And so I think there's basically a double lesson there. First, that we need to cut our carbon emissions so that we reduce the risks of wildfires, floods, droughts, infectious diseases, all of the other bad stuff which is already happening and more is coming our way. But it should also be an instruction to those richer parts of the world that there are some people in the world who are breathing this stuff in every day. These large cities, particularly in developing countries, which have high levels of air pollution, which are, as I said, killing millions of people around the world. Those are the parts of the world which will benefit most from shifting fastest to a sustainable and clean energy system. So really addressing climate change, particularly if we do it in a smart way, is nothing but wins. It saves the planet, saves the environment. As I say, it's economically better. These are now the cheapest energy sources. There are more and better, greener jobs, but also it brings these massive health gains both now and out into the future.